Hello, my name is Yana Schur, and I'm an assistant professor working at the University of Global Health Equity here in beautiful northern Rwanda. As a neglected tropical disease, or NTD researcher, I lead studies on snakebite envenomation and podoconiosis with the goal of developing innovations that help vulnerable communities. At the University of Global Health Equity, our mission is to radically change the way healthcare is delivered around the world.
My name is Bikorimana Jean Paul. I'm a physical therapist. I also have a master's degree in public health. I'm a program director at Heart and Soul Africa. I've been working there for 6 years.
Hey guys, we are Do Hope. We're an organization in Kigali, Rwanda that provides training for vulnerable women to help produce safe income generating activities for these women to provide for themselves and their families.
We design and manufacture made in Rwanda products that are sold here in our shop and online. Our income is used to empower local women to start businesses that support livelihoods.
Together, we hope to develop a product that prevents NTDs common among rural farmers and especially among women. The first, podoconiosis, occurs among people whose skin is exposed to irritant soil over a long period of time. Those affected develop intense swelling and nodules that leads permanent disability, causing pain, social stigma, and isolation from communities. The second is snake bite envenomation. 13 species of venomous snakes exist in Rwanda, many in farm fields and near parks. Victims experience a range of symptoms that can lead to amputation, blindness, and even death. What do these NTDs have in common? They could all be prevented by a simple innovation: shoes. Unfortunately, many women in East Africa walk barefoot or wear flip-flops while farming, even though their husbands wear tall black rubber boots. Why is this? Women tells us that boots are only for men, that they are not comfortable, not feminine, and not affordable. Clearly, no one has asked these women what shoes they want to buy and to wear while farming. Our solution is to borrow an idea used by the World Health Organization for developing new vaccine, medicines, and medical devices. A target product profile, or TPP, outlines the desired profile or characteristics of target product that is aimed at a particular disease. For example, what are rural women willing to pay for footwear that protects them from NTDs? What are their preferences for design, materials, sizes, and durability? Our plan is to host focus group discussion with rural women across Rwanda to create women-specific TPP for shoes or boots that they are willing to buy and wear while farming. Next, we share this TPP with Do Hope, who will design and manufacture a prototype that meets the owner TPP specifications. Finally, we will ask rural women to test the new shoes design while farming at home. 3/4 of women in Rwanda engage in agriculture activities that put them at risk for podoconiosis, snakebite, and hookworm. This disease traps them in a cycle of poverty that affects whole household and the community. If successful, our idea will help girls and women to stay healthy, remain productive, and contribute to the health of the next generation. To achieve a long-lasting result, our project must be sustainable. Do Hope will sell shoes in their Kigali store, with proceeds used to offset the retail price of shoes for rural women. Heart and Soul Africa will promote shoes wearing by educating rural farmers and the community health workers about many ways that shoes protect our health.
Women are especially affected by neglected tropical diseases, but their perspectives on disease control have historically been ignored. Now is the time to hear women's voices, to include women in developing new solutions, and to empower women to share their solutions in Rwanda and beyond.